Girl, I me never born in a lace week. Me still shop at DDs, I'ma still shop at Macy's. Now go certain places. Me a girl, me no frightened for link, and me no frightened for face. Young girl, no for killing.
Hi guys, and welcome back to Naya's Bingy YouTube channel. First of all, I just want to say thank you to everybody who's been liking, sharing and subscribing my channel, my page, my social media. I thank you guys very much for supporting me, and I still can't believe the amount of people who are now following the channel, watching the videos and just liking the things that I'm saying, liking the things that they're hearing, and they feel like they can relate to me. So before we get into this video, I'm just going to say one shout out to the individual that makes these earrings. A lot of you have been commenting about my earrings. You say that you like the earrings that I've been wearing. So the lady who makes these earrings is an Instagram page called Purity. So that's at JERPURITY on Instagram. She makes very nice earring pieces just like this one. She designs them herself, she paints them herself. She's very, very good, and the prices are lovely and affordable. So support a sister, go follow her page, look at some of the designs that she has, and DM her. Sometimes she will even give discount codes as well on certain occasions. So just look out for her pieces. I also want to say, please follow my cousin Brittany Petinod, okay? She is a chef. She's a very good cook. Anything you ask her to do, she's able to cook it. She can make it to the best of her ability, and it tastes absolutely beautiful. She taught me to cook half the things I know how to cook now, okay? So go over and subscribe to Brittany Petinod. She shows you how to cook, how to make certain dishes, what ingredients to add, what complements what food, etc. So please go ahead and follow. So let's get into this video. So today's video is going to be about the pregnant lady who was a YouTuber. She was also a dancer. She was quite a young girl by the name of Nicole Thea. So she was on YouTube. She did a lot of videos. I understand that she did a lot of dancing as well. She died at the age of just 24. She was so young. I heard about this about the week before last, that she passed away unexpectedly. I don't think the family wanted to put out any more information other than that. I think they just wanted to be left alone and given their privacy, as they are they've got their right to do so. So it has now come out that she had passed away unexpectedly from a heart attack. Unfortunately, she passed away. She also passed away with her unborn son. They were expecting a baby boy. They were going to name the baby boy Rain. First things first, the topics that I want to get into is about Black women in healthcare, Black women, their mortality rates, the issues that affect them in healthcare, maternal death as well is very important. So I want to get into those things today. So first things first, the American Medical Association has stated that Black women are more likely to die during childbirth and labor 5 times at a higher rate than any of their counterparts from other races, and especially of white women. So we are 5 times more likely to die than anybody else, unfortunately, when it comes to childbirth and labor. So we have higher mortality rates than anybody else. The New York Times in 2014 also put out a report that Black women, 20% of us at a childbearing age, so when we're able to get pregnant, when we're able to have children, unfortunately, we have 20% of Black women that suffer from infertility issues. So they are unable for a lengthy amount of time than counterparts of other races to get pregnant and have children. In 2019, a doctor reported to the BBC that Black people and Asian people are more likely to suffer from healthcare conditions. They're at risk of conditions in their health during their lives. They're more likely to suffer than anybody else. And what contributes to this is socioeconomic inequalities that they suffer from, which could be factors such as income, such as the areas that they live in, as well as class and income as well. We also have celebrities such as Beyonce and Serena Williams, who are at the top of the financial status. They hold financial wealth. They are at the top tier for Black women. However, in their pregnancies, they have both reported that they had suffered from healthcare conditions during their pregnancies. And it is known that Beyonce had reported that in at least one of her pregnancies, she suffered from a condition called preeclampsia, which automatically makes her pregnancy high risk. In March 2020, so that is this year, about 4 months ago, the Royal College of Obstetricians and Gynecologists reported that Black women are more likely to suffer from conditions during their pregnancies, childbirth and labour, such as preeclampsia, hypertension, cardiac arrest, heart attack, anemia and hemorrhage. And that Asian women are more likely to suffer from conditions such as diabetes, which can affect them and put them at great risk during pregnancy, childbirth and labour. In general, so for both women and men, conditions in healthcare such as stroke, high blood pressure, heart attacks, heart disease can have contributing factors such as can be contributed by stress, fatigue, tiredness and the body feeling overworked. It is also reported that those from Black and minority ethnic backgrounds are living in the lower socio-economic development areas in the UK, which may also mean that they have to work very hard. They are in jobs where they have to work longer hours. Some of these people are working more than one job, sometimes 2 to 3 jobs at a time. Some of them are working for less money. Some of these people have more outgoings than income, which can lead to stress and fatigue. Coming from a lower socio-economic background could also lead to a lower quality of life, and due to lower income, you're also more likely to have lower quality foods. In 2016, The Guardian reported that those from Black and minority ethnic backgrounds are more likely, or less likely, I should say, to access services in healthcare that are made available to them. And once they have a condition that has been diagnosed, they're more likely to search for natural remedies such as roots, herbs, spices, ground provision, and organic foods before they are going to go and seek medical attention, medical advice from a physician, diagnosis, testing from a hospital, from physicians, or access medical care, or before they accept synthetic drugs and medication for their condition. Therefore, those from Black and minority ethnic backgrounds are more likely to wait until they have the condition or until they experience symptoms of a condition before it is taken care of. Therefore, it is less likely for their condition to be diagnosed or picked up on or tested for beforehand. The condition will already be present and in their system before they take action, or before they are likely to try and prevent it or get rid of the condition. In 2016, The Guardian also reported that a Black individual is less likely to be prescribed opiate medication, opiate analgesia, pain relief than a white counterpart. So this means that they were less likely, even though that they were in pain, to receive pain relief than somebody who is white or somebody who is of another minority than a Black person. This can only conclude or be perceived that in healthcare, our pain is not empathized with as much as those from other races or those of our white counterparts, which means we are not seen as those who suffer pain as much. Usually it is the stereotype that Black people are seen as strong, we can handle pain, we can take it. So therefore, when people see us in pain, or when professionals, physicians see us in pain, they're less likely to prescribe us analgesia, pain relief medication in order to eradicate our pain. A university lecturer from Middlesex University in 2019 also made a report and wrote to the British Midwifery Journal that it is important for us to make improvements, especially in the inner cities where those from Black and minority ethnic backgrounds usually reside, and up to 40% of those who live in these inner cities, especially in inner London, were not born in the UK. It is important that we work with these communities and we educate ourselves, and we have educational classes and updates and safety training on how to deal with those in Black and minority ethnic backgrounds and those communities. It is important that we are taught on cultural awareness, and it is important that we increase our training and education on diversity. So I say all of this to say that it is unfortunate what happened to Nicole Thea, but unfortunately she is not the only one who suffered, and she will not be the only Black woman who suffers and dies at a higher rate than those from other counterparts and those of our white counterparts, unfortunately, when it comes to childbirth and labour. I also urge Black women, Black people in general, Black and ethnic minority backgrounds to seek medical attention, go for regular checkups. When you feel like you're in pain or there is something wrong, that you voice it, because I know that it is less likely for those from Black backgrounds to state that they are in pain or that they feel like something is wrong medically. We are more likely to stay silent, to suffer in silence, or to seek our own remedies before we seek medical advice and medical attention. I also advise those from Black and ethnic minority backgrounds that it is so important that we take care of our health, we look out for signs and symptoms, we educate ourselves on certain conditions and what it means for our health, and how quickly our health can deteriorate if we are more susceptible to certain conditions. Thank you for watching this video. I hope that I expressed all the content that I needed to. I hope that I gave you guys some knowledge, which is also backed up by facts, which is backed up by reports, journals, etc. And you guys can also do your own research and look out for your own health. Thank you for watching. Please like, subscribe and share.